Good day everyone, I'm Maria Angela L. Arcega and for today's presentation is about the 2009 health issues which is the 2009 H1N1 pandemic. So I'll start with a background. Influenza is a highly contagious acute respiratory disease and one of the most common viral respiratory infections that affects humans. The H1N1 virus first detected in the US or United States in April 2009. And on June 11, 2009, the Centers for Disease Control and Prevention or CDC declared an H1N1 pandemic. The virus was initially called swine flu as it contained genes never seen before in animals or people. They most connected to the swine lineage, hence the nickname swine flu. The outbreak affected on average people 25 years and younger, meaning the younger generations of our society. It affected people of all gender, race, and people around the world, particularly those younger than 5 years of age, older than 65. Then, a swine flu originated from pigs. So let's proceed to the spread. This image graphically illustrates how the H1N1 virus spread around the world, putting more and more people at risk of infections. So it started in America but looked more like Mexico and then quickly spread throughout United States, South Africa, South America, all the way around the world. And what causes of swine flu? Swine flu is caused by a strain of influenza virus that usually only infects pigs, unlike typhus which can be transmitted by lice or ticks. Transmission usually occurs from person to person, not animal to person. You can catch swine flu from eating properly cooked pork products. Okay. Ang swine flu po ay hindi po talaga siya nakakaapekto sa mga tao, kundi yung mga nag-aalaga po ng mga pigs, sila po yung kadalasang tinatamaan po ng swine flu. Let's proceed to the risk factors of swine flu. Some people have a higher risk of flu including H1N1 or having severe symptoms or complications. These individuals includes people po na age over 65 years, bata po na under 5 years, people with conditions such as diabetes, HIV or cancer, yung mga pregnant woman po or buntis, people with chronic like lung disease such as asthma, people with chronic heart disease such as heart failure, anyone with a compromised immune system, children with neurologic conditions. Then what are the symptoms of swine flu? The symptoms of swine flu are similar to those of regular flu. They include body aches or pananakit ng katawan, chills, pag-uubo, headache, sore throat, paglalagnat, tiredness, vomiting, and diarrhea less commonly. In severe cases, there may be respiratory failure and death, but this is rare. Most people's symptoms are relatively mild. However, young children, old people, pregnant women, and those with a compromised immune system may have a higher risk. Posible na ang H1N1 flu or swine flu ay hindi magpakita ng anumang physical na sintomas, ngunit mayroon pa rin ang pasyente. Let's proceed to prevention. If a person has flu, the following tips can help prevent further spread. Limit your contact with other people. Mahalaga po ito para maiwasan po natin yung pag-spread ng virus. Do not go to work or school while experiencing flu symptoms. Cover the mouth with a tissue when coughing or sneezing. If no tissue is handy, cover the mouth and nose with your hand or crooked arm. Put your used tissues in a trash can. Wash your hand and face regularly. Mahalaga rin po ito. Keep all surface that you touch clean. Dapat po malinis po ang ating hinahawakan at siguraduhin na sanitize po ang lahat. follow all doctor's instructions. The annual flu shot can offer protection from various types of flu. Those whose work or lifestyle brings them into contact with swine and other animals should trusted source. Follow all health and safety precautions when handling animals. Ensure that swine have their relevant vaccinations. Mahalaga po to na may relevant vaccination. Call a vet if an animal appears sick. Avoid contact with pigs if they or other animals appear ill. And for the last slide, how did they get rid swine flu? So, the U.S. Centers for Disease Control and Prevention, or CDC, recommends the use of oseltamivir or Tamiflu or Zanamivir Relanza for the treatment and or prevention of infection with swine influenza viruses. However, the majority of people infected with the virus make a full recovery without requiring medical attention. Kadalasan po kasi ang makakatulong lang po sa mga tao na naapektuhan po ng virus na ito para gumaling po sila ay ang kanyang sarili. Kung paano po sila maging aware to prevent the diseases. Kasi sabi nga po nila, prevention is better than cure. Thank you so much for your interest and attention. I hope may natutunan po kayo sa report ko ngayon. Yun lamang po. Maraming salamat.